Have you been struggling with knee pain, but find it hard to stand for long or move around easily? The good news is you do not need to stand to make your knees stronger and feel better. In today's video, I am going to show you 8 simple exercises you can do while sitting on a sturdy chair. These seated moves are gentle, safe, and perfect for seniors with limited mobility. They will help relieve stiffness, reduce pain, and slowly rebuild the strength in your legs so you can move with more confidence in daily life. All you need is a stable chair and just a few minutes of your time each day. So let us get started. Exercise 1. Seated marching. Imagine this. You're sitting comfortably on a sturdy chair, but instead of just resting, you begin to lift one knee and then the other, almost like you are marching in place. At first it feels simple, but with every lift you are actually waking up the muscles in your thighs and hips. These are the very muscles that protect your knees from strain. When the knees ache, many people think they need to avoid movement, but the truth is the opposite. Gentle motion is what brings fresh blood flowing to the joints, washes away stiffness, and tells the nerves it is safe to move again. That is why even a small march in your chair can make such a big difference. As you lift your knees, remember to sit tall with your back straight against the chair. Keep your movements slow and controlled, and do not worry about lifting your knees too high. Even a few inches is enough. Try to keep breathing naturally and avoid leaning forward or swinging your upper body. So as you march, picture yourself turning on the circulation pump in your legs. You are not just moving, you are giving your knees a signal to heal and your legs a strength to carry you with more confidence. Try marching for 30 to 60 seconds at a time, then rest for a short break. Repeat this 2 to 3 rounds in one session, and if it feels comfortable, practice once or twice a day. With steady practice, you will notice your legs feel lighter, your steps steadier, and your knees less painful. Exercise 2. Seated heel slides. Sit tall on a sturdy chair with your feet flat on the ground. Slowly slide your right heel forward, stretching your leg out in front of you, and then gently pull it back until your foot is under the chair again. Repeat this motion in a slow and steady rhythm, then switch to the other leg. This movement may look small, but it works like oil for a stiff hinge. Each time your heel glides forward and back, the knee joint learns to bend and straighten more smoothly. For many seniors, stiffness builds up because the knees stay in one position too long. Heel slides break that stiffness, increase circulation, and gently remind the joint how to move without pain. As you do the exercise, keep your back straight and avoid leaning too far forward. Move only within a comfortable range. You do not need to force your leg fully straight if it feels tight. Breathe normally and keep your movement slow and controlled. Aim for 10 to 15 heel slides on each leg. After finishing one side, rest briefly and then switch to the other. Repeat the cycle 2 or 3 times, once or twice a day, depending on your comfort. With consistent practice, your knees will feel more flexible, making everyday activities like walking or standing up much easier. Exercise 3. Seated knee extensions. Sit upright on a sturdy chair with both feet resting flat on the floor. Slowly lift your right foot by straightening your knee until your leg is extended forward. Hold this position for 3 to 5 seconds, feeling front of your thigh working, and then gently lower your foot back down. Switch to the left leg and repeat. This exercise directly strengthens the quadriceps, the large muscles at the front of your thighs. These muscles act like shock absorbers for your knees. When they are weak, every step puts more stress on the joint. By practicing the extensions, you're building the support your knees desperately need, making daily activities like climbing stairs, standing up, or walking much easier. As you do this, keep your back straight and avoid leaning forward. Do not lock your knee when you straighten it. Just extend until you feel the muscle engage. If it feels too hard, shorten the movement and lift only halfway. Over time, your strength will improve. Aim to perform 10 to 12 repetitions on each leg. Rest for a moment, then complete 2 to 3 rounds. Practicing this exercise once or twice a day will gradually rebuild strength in your legs and help relieve pressure on your knees. Exercise 4. Seated heel raises. Sit tall on a sturdy chair with both feet flat on the ground and your knees bent at 90 degrees. Slowly lift your heels off the floor as high as you comfortably can, keeping your toes planted, then gently lower them back down. Repeat the motion in a smooth and steady rhythm. At first, it may feel like only your calves are working, but this small movement does much more. Each time you rise onto your toes, the calf muscles contract, pumping blood back up from your lower legs and easing that heavy, tired feeling many seniors experience. Strong calves also support the knees by absorbing shock every time you walk, protecting the joints from extra strain. As you practice, keep your back straight against a chair and avoid bouncing or rushing the movement. Focus on a slow lift and an even slower return, breathing naturally throughout. If balance is an issue, hold onto the sides of the chair for support. Try doing 12 to 15 heel raises at a time, then rest and repeat for 2 to 3 rounds. Once or twice a day is enough to bring real results. With consistent practice, you will notice not only stronger calves, but also more stable knees and lighter steps when you move around. Exercise 5. Seated toe raises. Sit comfortably on a sturdy chair with your feet flat on the floor and your knees bent. This time, keep your heels planted firmly and slowly lift the front of your feet, raising your toes toward the ceiling. Hold for a brief moment, then gently lower them back down. Repeat the motion at a calm, steady pace. Although it feels like a simple movement, toe raises strengthen the muscles along the front of your lower legs, which are often overlooked. These muscles help lift your feet when you walk, preventing trips and stumbles. For seniors, keeping them active is one of the best ways to maintain safe and confident steps. As you do the exercise, remember to sit tall with your back straight and breathe naturally. Avoid leaning backward or lifting too quickly. The goal is control, not speed. If you feel tightness in your shins, that is a good sign the muscles are engaging. Perform 10 to 15 repetitions, rest briefly, and repeat 2 or 3 rounds. Practicing once or twice a day is enough to make your ankles stronger, your steps steadier, and your knees better supported during daily activities. Exercise 6. Seated hip abduction with band. Sit tall on a sturdy chair with your feet flat on the ground, and place a resistance band looped around your thighs just above the knees. From this position, slowly press your knees outward against the band. Hold the stretch for 2 to 3 seconds, then gently bring them back together. Keep the movement smooth and controlled, without letting the band snap your legs back in. At first, it may seem like only a small push, but this exercise is powerful for strengthening the muscles on the outside of your hips. These muscles are what keep your knees from collapsing inward when you walk, stand up, or climb stairs. By training them, you are giving your knees extra support and helping the joints stay stable and aligned. As you perform the movement, keep your back straight against the chair, breathe steadily, and avoid holding your breath. Focus on control. It is better to push a little with good form than to force the band too far. Do 10 to 12 repetitions, rest briefly, and repeat for 2 to 3 rounds. Once a day is enough to build strength in your hips, and over time, you will notice that standing, walking, and moving about feels safer and less painful for your knees. Exercise 7. Seated hamstring stretch. Sit near the edge of a sturdy chair with your back straight and both feet on the floor. Extend your right leg forward with the heel resting on the ground and the toes pointing slightly up. Keep your left foot flat on the floor for support. Slowly lean your upper body forward from the hips, not from the shoulders, until you feel a gentle stretch along the back of your right thigh. Hold the position for 15 to 20 seconds, breathing deeply. Then return to upright. Switch to the left leg and repeat. This stretch directly targets the hamstrings, the long muscles at the back of your thighs. When these muscles are tight, they pull on the knees and lower back, making movement stiff and uncomfortable. By stretching them, you release that tension, improve flexibility, and make walking, standing, and even climbing stairs easier. As you stretch, keep your back straight and avoid rounding your shoulders or forcing yourself too far forward. The goal is a gentle pull, not pain. Even a small lean is enough to get results. Repeat the stretch 2 to 3 times on each leg. Doing this once or twice a day will gradually loosen the muscles, reduce pressure on your knees, and help you move more freely. Exercise 8. Seated straight leg hold. Sit upright on a sturdy chair with both feet flat on the ground. Slowly lift your right leg forward until it is straight, keeping your thigh off the chair and your toes pointing up. Hold this position for 3 to 5 seconds, feeling the front of your thigh working. Then gently lower your foot back to the floor. Switch to the left leg and repeat. This exercise is one of the best ways to directly strengthen the quadriceps, the large muscles at the front of your thighs that act as shock absorbers for your knees. When these muscles are strong, your knees are better protected from strain and pain during everyday movements like standing up, climbing stairs, or walking longer distances. As you hold your leg out, remember to sit tall with your back straight and avoid leaning backward or swinging your body. The key is slow, controlled motion. If you find it difficult to fully straighten your leg, just lift it as far as is comfortable. Over time, your strength and range will improve. Aim to perform 8 to 10 holds on each leg, resting briefly in between, and complete 2 to 3 rounds. Doing this once or twice a day will gradually build lasting strength in your legs, making your knees feel more stable and your steps more confident. And there you have it, 8 simple but powerful exercises you can do while sitting on a chair. Each one is designed to ease stiffness, strengthen your legs, and give your knees the support they need, even if standing is difficult for you. Remember, consistency is the key. Just a few minutes each day can add up to real changes, less pain, more strength, and greater confidence in your daily movements. So keep practicing, stay patient with yourself, and celebrate every small step of progress. Your knees and your body will thank you for the effort. If you found these exercises helpful, make sure to subscribe to the channel. Leave a comment to share how they work for you, and pass this video on to a friend who may also need gentle relief for their knees. Together, we can keep moving forward one small step at a time.